It was 2014, and Steve Thygerson was driving down a narrow road in Nepal. It was his first time ever visiting a brick kiln.
It was like we stepped into a totally different world. So these brick factories, many of them are right off the main road in the Kathmandu Valley. When you drive in, it's a community. It's a village. So the workers and their families all live within 300-400 yards of this brick factory. And it's all outdoors. And then the first thing I saw were these little ladies, probably 5 feet tall, with bowed legs, carrying over 130, 140 pounds of bricks on their head and on their back. And it was a line of them. They were just going from one area of the brick kiln, carrying these, what's called a green brick. It's an unfired brick, carrying it into the brick kiln. And when I saw that for the first time, I thought, okay, this is like National Geographic type stuff that I've never seen before. And so the working conditions here, immediately I thought there's need here for sure.
Welcome to the Why Magazine podcast, bringing you ideas, stories, and voices from Brigham Young University. My name is Whitney Archibald, and today's episode is all about BYU's Nepal Global Health International Study Program. We'll talk to Steve Thygerson, the BYU public health professor who started the program, about the challenges facing these brick kiln workers and how he's helping identify and evaluate health risks with a team of researchers from the U.S. and Nepal, including BYU students. We'll also get to talk to one of those BYU students, Sabina Magar, who was actually born in Nepal and was thrilled to see Nepal Global Health on the list of BYU international study programs.
I know I want to go and study abroad, and Nepal, it's where I'm from. That's perfect. So I said that I want to go. I will do it because it's an amazing opportunity to return back to my country.
This episode is based on the article Life and Breath by Kate Hansen-Robertson in the spring 2024 issue of Why Magazine. It all started with brick kilns. Steve Thygerson heard about the health risks of working in brick kilns in Nepal at an occupational health conference and had to know more. He made some contacts with public health researchers in Nepal and soon went to visit the brick kilns himself. It turns out that the biggest problem facing these workers is actually really, really tiny: dust particles.
You could see the dust everywhere. It was this red clay, dry dust that you step in it and it just poofs everywhere. So one of the first things we did was, okay, what's in this soil? So we started with some soil samples. We found out that it's about 17% silica. So silica is a mineral, it's naturally occurring, but silica causes severe lung disorders that are irreversible. So we knew that there was respirable dust, very small particles of dust, because you could see it. And then we know that, the smallest stuff you can't see, the microscopic dust. But then knowing that there's that amount of silica in there, that really was our push. Silica exposure assessments was going to be our number one priority for these folks. So that's where we started, is we needed to evaluate the workplace conditions and the airborne exposures to all of the workers.
This kind of research is Steve Thygerson's specialty, industrial hygiene. He set to work putting together a team of researchers from BYU, Johns Hopkins University, and two Nepali universities, Kathmandu University and Tribhuvan University. The interdisciplinary team includes environmental scientists, public health experts, statisticians, and several physicians and other healthcare specialists who help evaluate the health risks for kiln workers.
So when we look specifically at silica, it has a very low exposure limit. Here in the United States, we have regulatory exposure limits. Like if you were to make bricks here in the States, you can't expose workers above a certain concentration over 8 hours a day for their working lifetime. So when we went to Nepal, our foundational study on silica that was published in 2018 showed that the dustiest jobs in these brick kilns were about 17 times higher than what the exposure limit is here in the United States. What would happen to someone who's exposed at those levels is silica, it's a very small particulate, it gets into the deep reaches of the lungs. and our body has a very, very hard time removing it. As such, it can become carcinogenic, but it also it starts scarring the lung. It starts limiting the function of the lung and causes a disease called silicosis, which is an irreversible health effect. And what's interesting about silica is it does take at least 5 years for this to develop, and sometimes longer, many times longer. Many of these workers don't work in the brick kilns for 5 years. They might work there for just a season, but even a season at those levels, that could lead to silicosis. And if it's not leading just to silicosis, that obviously there's a lot of dust in there. So they're having a lot of asthma and bronchitis and coughing and hacking and, sputum and things like that. So anything that you can think of dealing with a chronic respiratory condition, that's what we're actually seeing in many of these workers. And these workers are young. This is a young workforce. There definitely are people under 14 working in the brick kilns to mid 40s, but the majority are right in that low 20s, and many of them migrant workers.
The team has now visited all the brick kilns in the Kathmandu Valley, at least for a basic survey, and has done more extensive research in 64 of the kilns. All this work sounds great, but as I talked to Thygerson, I kept wondering, what do the owners of these brick kilns think about all this research? I asked him, are the owners worried you're trying to shut them down?
I think in the beginning, there was a little bit of distrust. Like, what are you doing here? Are you with the government? Yeah, who are you with? Yeah, we're making lots of brick. We don't want you to come in and do anything to affect our brick production. Over the years, especially working with the Brick Kiln Owners Association, those relationships have been strengthened. In fact, in late 2021, the Brick Kiln Owners Association invited our team to their hotel. They all own a hotel together up in the hills, and they provided lunch for us, and they presented what we were doing, and we took pictures, and it was a really good coming together. And so they were actually happy to see that it's our local people who are directing this, but there's global assistance as well. So they like that. That kind of added some credibility to it.
Thygerson always hoped to get students involved with the research too, but at first that wasn't possible.
When I started talking to the Kennedy Center here at BYU, they have a long list of countries that faculty can go to, but don't even ask us if you can take students there, because the answer is going to be no. Nepal happened to be on that list. It happened to be on the list of don't even ask us until 2018. So in 2018, some of the civil unrest had really settled down in Nepal. We had a lot of good contacts there. I consider Nepal a very safe country. And in 2018, they removed that to where we could now ask. They would review it, and we could take students there. So that was our first trip, 2018. We had 11 BYU students. We took them over there, and then they trained university students there how to conduct air sampling. So on every site, we usually had a Kathmandu University student with us who was learning alongside our students, and our students were teaching them how to do it.
Except for a COVID hiatus, Thygerson has been bringing about 12 to 16 students to Nepal ever since for a 30-day internship with the local research team. And what started as just brick kiln research has expanded into other areas of public health in Nepal.
I had a student who had taken a couple of my classes, Chelsea Martin, and she was an undergraduate student. And she came to me and said, I am just fascinated by Nepal, and I would love to go over there, but my area is not occupational health. My area of public health is maternal child health. And so she first obtained what we call a CURA grant. It's called the College Undergraduate Research Award. And she got a small team together. They went over with our normal brick kiln students, but they went up to a hospital called Dulakil Hospital. It's a small hospital located about 6 hours by Jeep outside of Kathmandu, on a remote hillside. When you think Nepal, this is it for sure. You're on the village on the side of some steep foothills, just a beautiful location.
That maternal and child health research has expanded until now half the students that participate in the Nepal Global Health Program go to that remote village to study and support maternal and child health, and the other half are on the brick kiln team. In 2024, Sabina Magar discovered the program, applied, and was selected for the team. The last time she had been in Nepal, her home country, was when she was 8 years old. She doesn't remember much of her childhood in Nepal.
We lived in refugee camps. When I was a child, I didn't know this. But as a child, you really don't know what's going on. You're just happy to be with your family, with your friends. The whole day, I would basically hang out with my friends, play with them outside on the sand or with some marbles that we found on the ground.
Life wasn't easy for Sabina's family in Nepal. They had been living in Bhutan, where they faced intense persecution and then fled back to their home country of Nepal as refugees. Then, when Sabina was 8 years old, her parents, her brother, and sister were able to move to the United States. Sabina joined the Church of Jesus Christ of Latter-day Saints 2 years later and eventually found her way to BYU, where she found out about the Nepal Global Health Program.
I got the email that I was accepted to go, and I was just so happy. When we landed on the Tribhuvan International Airport, I saw a big sign that said visa or passport written in the Nepali language. And I was like, I can read that. I was just so excited. Like, there are people all around me. There's Nepali people. I am in Nepal.
Oh.
It was just, I couldn't believe that I was in my home country. I never thought I could go this early, but it just felt home. I remembered the air that I breathed when I was a child, the roosters that woke us up every morning, and just the Nepal air. It was just, I felt home. So we just met with the research team, the Nepal research team, 10 to 15 of them. They were amazing, but they taught us how they measure the respiratory health of the brick kiln workers. And we did get to see a brick kiln, how we got to see the teenagers, some boys and 10 to 12-year-old girls who work there, who come there because their families come and they pick up those bricks. And just to see them in that condition, it was just like they're children and they're working and not going to school.
In addition to visiting the kilns, Sabina Magar and the other students helped the research team clean and maintain the equipment that measures air quality and helped process data from surveys of the kiln workers. Meanwhile, the maternal and child health team stayed in a small family-owned hotel in a remote village called Dolaka. There, they worked at the local hospital on projects related to health infrastructure and maternal health care, and at local schools to educate the children about health and hygiene. Both teams also volunteered at hospitals, health clinics, orphanages, and family homes. Here's Sabina again.
We went to I think it's called Ellen's Orphanage. There's around 200 kids there. But I met those kids there the first time. Ellen did this very sweet thing where she just called me in front of them. And she asked me to speak both in Nepali and English, to kind of surprise them. Like, oh, she speaks both Nepali and English. But all those kids, they just looked up to me and they were asking everything about America. There was this, almost everyone I met though, they were just so surprised that I speak Nepali, I'm Nepali and I'm America and all this, but they also really helped me to increase my desire to help children a lot, because they're just precious and I could connect with them because I was also a child when I was in Nepal.
That orphanage visit was a highlight for Thygerson as well.
To see her interactions with the locals and the kids, I could have just watched that for the entire time. It was so special.
The team also volunteers with international organizations such as Days for Girls, whose founder and CEO are also BYU alumni. In fact, we recently told the Days for Girls story on this podcast. We'll include a link in our show notes. And of course, you can't go to Nepal without a trek through the Himalayas.
We trekked for 4 days. We had a trekking guide named Chet and other porters who were amazing. We spent a lot of time Like, they really took care of us during the trek, and we sang songs. We encouraged each other to keep going. But one special thing during trek was we celebrated Chet's birthday, which was the first time in his life that he even celebrated his birthday. It was May 24 that we surprised him with a birthday cake, and we were in a hotel and we just turned off all the lights, brought a cake, and wished him happy birthday. And it was just so sweet. Someone was never had a birthday celebrated for him, who didn't even know his birthday. Right after that, he said May 24 would be his birthday, and he would celebrate it every year. And he would call us, okay, now I have 13 daughters, 12 us, and one of his daughters. So it was very sweet. So that was one of the really good memories. And also, while on trek, I actually met two Magar, like ethnicity, and my last name, Sabina Magar. I met two men that were Magar ethnicity. And when I saw them, I just felt even more connected.
Thygerson continues to oversee the Nepali Global Health Internship Program, which is beginning to enter the next stage of the process, using the data they have collected to implement solutions. The team is currently investigating the use of personal protective equipment, or PPE, N95 masks to protect workers, as well as exploring different methods of carrying the brick so all the dust doesn't rain down on the heads of the kiln workers, as well as other solutions. In addition to being able to help these workers that he's learned to care about so much, Thygerson is grateful for all the people he's met along the way.
I probably have more friends abroad now than I have in country. The relationships I've been able to develop, that's been probably the greatest blessing of my life, is being able to just email, WhatsApp, call, Zoom, whatever with these people anytime I want. And those relationships are greater than just a professional relationship. I've had them in my house. I've been to their house. I know their family. I've been to their weddings, and it's just, that's the greatest blessing. Another one is I've been able to take my family to these countries, and my kids have been able to experience that as well. That's been an amazing blessing as well in my life.
Sabina plans to finish her dietetics degree at BYU, then go on to get a master's degree and become a registered dietitian. After she gets some work experience in the United States, she hopes to go back to Nepal and work with some of the doctors she met to help develop nutritional programs and education for Nepali communities and schools.
I love the BYU mission that says, enter to learn, go forth to serve. I really like that. That has always inspired me. And being in Nepal, we went to orphanages, we went to schools and saw children. We went to geriatric hospitals, and we just got to see all these people, and it just motivated me more to focus on getting as much education as I can, so I can go forth and serve these people. And I do want to go back again to Nepal to help. First, I need to gain all the skills I can with dietetics or national development, all of those, so I can go and help them effectively. But that it's helped me academically to work hard, gain all the education skills I can, so I can go back and serve them.
Thank you for listening to the Y Magazine podcast. If you enjoyed this episode, you'll probably also enjoy the episode about Days for Girls that I mentioned earlier, called Saving Days, Ending Period Poverty with Days for Girls. You can also check out episodes about other BYU study abroad programs, Mapping Molokai and Students Engineer Prosthetic Solutions for Ecuador. You can find all those links in our show notes. Special thanks to Kate Hansen-Robertson for writing the article this episode is based on, Life and Breath, in the spring 2024 issue of Y Magazine. This episode was produced by me, Whitney Singley Archibald, with executive producer Brooklyn Hughes Romer. Original music, mixing, and mastering by Jarrett Davis.